For me, this is many, many Christmases combined into one, because this kind of medicine is really, really hard to come by. Hey friends, we've finally done it. We've got all the medicine together. So we're just gonna go inside and pack, and I'll let you know where everything's going. And then hopefully in a couple of weeks, we can show you these things in the hands of people that need them. Come on in. In Cuba, oftentimes if you get sick, you really don't have access to any medication. It's some herbal medicines, water, tea, but oftentimes people don't even have running water, right? Cuba doesn't have access to these drugs for a pair of reasons. One of them is that there is a blockade on Cuba, and many things can't be sold to the country internationally as a result of it. Many cancer medicines that have patents only in the US, for example, are completely denied to Cubans. It's a complex issue, and at the end of the day, it's the Cuban people that suffer. And one amazing thing about this project is that we know exactly where every piece of donation is going. We have a network of about 4,000 or 5,000 people that we donate medicine to in Havana. It's a group called La Medicina No Se Vende, which means one does not sell medicine. Unfortunately, there's a huge black market for medicine in Cuba today, and people are very desperate and they can't afford it, so often they go without. And it's just, I think, one of the things that living here, it's really easy for us to access, but over there, not so much. I mean, we only take stuff that people are already using, right? Like, we take medicine that the sick here have used and they can no longer use, and we give them to the sick over there. And penicillin, the best, never gets old. Yeah, it's amazing. It truly never gets old, almost never. So we take in donations of any kind of medicine. It doesn't matter if it's 5 years expired, 10 years expired, we can use it. Most medicine doesn't expire. There have been many studies done, primarily by Harvard University. I know that when I was in Cuba, I was sick once, and I used antibiotics that were 10, 15 years expired, and I was so thankful for them because they took me out of a very serious infection. So very thankful for what all of our friends share. The most useful donations are antibiotics, over-the-counter pain medicine, but really people's expired medicines are surprisingly useful because we can't buy that stuff. We can't buy antibiotics. When you're living in a situation when you have nothing and you need everything, everything is useful. So anything that people share will go a really long way. So this item is one of the items I'm most excited about donating, and our friends Song and Jamie donated towards the purchase of this. Amazing people. This is a DeWalt reciprocating saw. And this is going to come in extremely handful in the operating room for vascular surgery. We are unfortunately having to do a lot of amputations, and we're doing it using a wire saw, which is basically technology from the early 1900s. So this will help a lot of patients. Almost 30 vials. This, at least 5 to 10 operations, depending on the weight of the patient. It's incredible. So thankful. The operating rooms are often not functioning for the lack of something as basic as lidocaine. You can perform, I don't want to call it a minor amputation, but a medium amputation, like of a foot, just using lidocaine in certain cases. And oftentimes we can't perform these operations that are needed to save people's lives because they're infected and their infection is crawling up, and the only way to get rid of it is to, unfortunately, cut off a limb. A Rotarian in Mission donated these. Unfortunately, sometimes when you're on this path and you're trying to just, share privilege, people get in the path. So the people in Havana at the airport wanted to not let me bring this stuff in, and they started talking about how I've got to pay extra money, or it's not going to be released to me in general. I prepared myself by sprinkling some items on the top of these containers that I knew that if they opened it, it would catch their attention and they would be tempted to either take it from me directly or at least ask for it. So at the time, the products were Tylenol and condoms. This time, we're also spicing things up because unfortunately the situation has gotten really bad. Quick tests for pregnancy is another thing that we're going to be sprinkling on the top of these containers. This is another thing that's really lacking in Cuba right now, which is really scary because people don't have condoms, the pregnancy rates are going up, the disease rates are through the roof. This item's a goodie. So this is just a pen. You'd be surprised how useful something like this can be. I think I'm going to leave this with a dentist, a very kind dentist, because she has no light to look at, and a cell phone isn't that effective. So, ooh, glucometer. So diabetic patients, of which there are so many in Cuba, if they're lucky enough to have their insulin, they often inject it blind, which means they just take the same amount every day. It doesn't matter if that day they ate less or ate more, or something is off with the hormonal system, they inject blind. So a glucometer is going to be very telling for someone and potentially life-saving, because my goodness, injecting that blind is very dangerous. For me, this is many, many Christmases combined into one, because this kind of medicine is really, really hard to come by. Injectable medicine. And when we run campaigns to sterilize street animals, this stuff comes in so handy. And on Saturday, we're actually going to be participating in a spay and neuter clinic. So I'll be taking this to the veterinarians over there. We had a very generous donation as well from the Interact Club of Chilliwack. Helped us to buy some of these materials. It's going to help as well to transport this material over to Cuba. But things like sutures, direly in need. There's a lot of cases that we're not operating for something as simple as suture. So thank you very much.